There is a drink that can lower your blood pressure by roughly 10 points, and the effect peaks about 2.5 hours after you swallow it. Read that again, because the timing is the entire point of this video. 2.5 hours, which means if you drink it right after dinner, the effect lands precisely during the window when your blood pressure is supposed to be doing something specific, something most people have never heard of, and something that is quietly one of the strongest predictors of whether you have a stroke in the next 10 years. Most people are drinking exactly the wrong thing at that hour. A glass of wine, because it feels like it relaxes you. A soda, a late coffee. All three work against you at the one time of day when the right choice matters most. Today, I am going to tell you what dietitians actually recommend instead. The biology of why it works, the exact amount, and the exact timing, and one strange mistake that completely cancels the effect. That last one is not a small detail. Researchers proved it by accident, and if you make this mistake, you can drink this every night for a month and get almost nothing out of it. Millions of people make it without thinking, every single night, right before bed. Let me start with the drink itself, because I am not going to make you wait for it. It is beet juice, plain, unsweetened beet juice, roughly 1 cup. And before you decide that sounds like health food nonsense, understand that this is one of the most heavily studied foods in cardiovascular research over the last 2 decades. Not studied by supplement companies, studied at universities, in controlled trials, with catheters and arterial monitoring, because the mechanism turned out to be genuinely important to how the human circulatory system works. The reason it works has almost nothing to do with vitamins. Beets contain unusually high concentrations of dietary nitrates. Nitrate is a simple molecule, 1 nitrogen atom and 3 oxygen atoms, and it is present in most leafy greens as well, though beets are among the richest common sources. Now here is where it gets interesting, and this is the part that surprises people. Your body cannot do much with nitrate on its own. It needs help, and the help comes from bacteria living on the back of your tongue. When you swallow beet juice, the nitrate is absorbed into your bloodstream, circulates, and then a portion of it is actually secreted back out into your saliva. It pools in your mouth, and a specific population of bacteria living in the crevices at the back of your tongue converts that nitrate into nitrite. You swallow the nitrite, and in the acidic environment of your stomach, and then in your tissues, that nitrite becomes nitric oxide. Nitric oxide is a gas. It is one of the most important signaling molecules in your entire cardiovascular system, and its discovery earned a Nobel Prize in medicine. What it does is tell the smooth muscle in your arterial walls to relax. The vessel widens. The same volume of blood now travels through a wider pipe. Pressure falls. That is the mechanism. And notice what it depends on. It depends on bacteria in your mouth. Hold on to that, because it is going to matter enormously in a few minutes. Before I go further, do me one small favor. Hit subscribe. That is all. It takes 1 second. It costs nothing. And it is the only signal that tells this channel to keep making videos that explain the actual biology, instead of handing you a list of 10 superfoods with no explanation of why any of them work. And if there is someone in your life who checks their blood pressure every morning and quietly worries about the number, send them this. The timing detail alone might be worth more to them than anything else they hear this month. All right, let us look at the numbers, because they are better than most people expect. At Queen Mary University in London, researchers gave healthy volunteers a dose of beet juice and then tracked their blood pressure continuously over the following 24 hours. Systolic pressure began falling within an hour. It reached its lowest point around 2.5 to 3 hours after drinking, with drops of roughly 10 points at peak. And measurable effects were still present when they checked at the 24-hour mark. Then a separate team ran the more important test, not healthy volunteers, actual patients with diagnosed high blood pressure. They gave them 1 cup of beet juice daily for 4 weeks and compared them against a placebo group who drank a nitrate-depleted beet juice, meaning the same taste, the same color, the same everything, with the nitrate stripped out. The beet juice group dropped by roughly 8 points systolic and 4 points diastolic, sustained over the 4 weeks. And the researchers also measured arterial stiffness and endothelial function, both of which improved. Now, 8 points? Let me put that in the context that matters. Cardiologists generally consider a sustained reduction of 5 to 10 points in systolic pressure to be clinically meaningful. Because at population level, that size of shift changes stroke and heart attack rates. This is not a rounding error. It is not the placebo effect. It is in the range of what a low-dose medication accomplishes. When you pool all the trials together in meta-analysis, the average effect is more modest, somewhere in the range of 3 to 5 points systolic. That is normal. Averages across many studies with different doses, different populations, and different durations always come out lower than the best individual results. But the direction is consistent across the literature, and the effect is largest in the people who started with the highest pressure. Now let me come back to timing, because this is where the after-dinner part earns its place. Your blood pressure is not a fixed number. It follows a daily rhythm. It rises in the morning, stays elevated through the day, and then at night while you sleep, it is supposed to fall. In a healthy person, nighttime blood pressure drops by roughly 10 to 20% below the daytime average. Cardiologists call this dipping. It is a normal, necessary part of cardiovascular function. It is the period when the entire system gets a rest. Some people do not dip. Their pressure stays flat overnight, or in some cases actually rises. These people are called non-dippers, and this is one of the most under-discussed findings in cardiology, because non-dipping is a stronger predictor of stroke, heart failure, and kidney damage than daytime blood pressure readings alone. Here is the problem. You would never know. Your doctor measures your blood pressure at 11 in the morning in a clinic. Nothing about that reading tells you what your arteries are doing at 3 in the morning. The only way to know is a 24-hour ambulatory monitor, which most people have never been offered. So think about the timing. You eat dinner at 7, you drink your beet juice, with it or just after. The nitric oxide effect builds over the next 2 to 3 hours and peaks around 9:30 or 10, exactly as you are heading to bed. You are supporting vessel relaxation during the precise window when your body is trying to bring pressure down for the night. That is not a coincidence. That is why the after-dinner slot beats the morning slot for this particular drink. And now, compare it to what most people actually drink at that hour. Wine. Alcohol feels relaxing, and there is a brief drop in pressure in the first couple of hours. But it rebounds, and it rebounds higher. Alcohol in the evening also fragments your sleep architecture, suppresses deep sleep, and elevates your heart rate through the night. Regular evening drinking is one of the more reliable ways to blunt or eliminate nighttime dipping entirely. Soda. Sugar in the evening drives an insulin response, and there is solid evidence linking sugar-sweetened beverages to higher blood pressure over time. You are also adding calories at the least useful hour of the day. Late coffee. Caffeine has a half-life of around 5 to 6 hours, meaning a cup at 8 in the evening still has half its caffeine circulating at 2 in the morning. It stimulates your sympathetic nervous system, the fight-or-flight side, which is the exact opposite of what should be happening at night. So the after-dinner drink is not a small choice. It either helps your nighttime dip or it fights it, and most people have unknowingly been choosing the second option for decades. Now, the mistake I mentioned at the start. This is the part I want you to remember above everything else. Remember that the whole mechanism depends on bacteria living at the back of your tongue, converting nitrate into nitrite. Without those bacteria, the chain breaks. Your body has no efficient alternative pathway. Researchers tested this directly. They had participants use an antibacterial mouthwash and then measured what happened to the nitrate pathway. The effect was largely wiped out. The mouthwash killed the tongue bacteria. Without the bacteria, no conversion. Without conversion, no meaningful nitric oxide from the dietary route. In some of this research, regular antibacterial mouthwash use on its own was associated with higher blood pressure readings. Think about what that means practically. You drink your beet juice after dinner. 90 minutes later, you go brush your teeth and you finish with a strong antiseptic mouthwash, the way you have done every night of your adult life. You have just destroyed the machinery your body needed to use what you drank. I am not telling you to abandon oral hygiene. Gum disease has its own well-documented link to cardiovascular problems, and brushing and flossing are not negotiable. What I am telling you is to reconsider the antibacterial mouthwash specifically, especially at night, especially if you are drinking beet juice for this purpose. Brush, floss. If you want to rinse, use plain water or a non-antibacterial one. That is it. Almost nobody knows this. It is the single most valuable thing in this video. Now, the practical details. How much? Roughly 1 cup, 8 ounces of 100% beet juice. That is the dose used in most of the sustained trials. If you buy the concentrated beetroot shots, the small bottles sold for athletes, a standard shot is around 70 milliliters and is formulated to deliver a comparable nitrate load. Check the label for nitrate content if it lists it. What to buy? Read the ingredients. Many products labeled as beet juice are actually beet and apple, or beet blended with 3 other fruit juices to make them palatable, which means you are getting a substantial sugar load along with the nitrate. You want 100% beet juice, ideally with nothing but beets on the label. If the taste is difficult, and for many people it is earthy in a way that takes adjusting to, add a squeeze of lemon or a small piece of fresh ginger. Both cut the earthiness considerably. Do not add sugar. You can also make it yourself, and honestly, this is cheaper. Raw beets in a juicer. If you have no juicer, a blender with a little water and then strain through a fine sieve works. If you truly cannot tolerate beet juice, the nitrate pathway is not exclusive to beets. Arugula, spinach, Swiss chard, lettuce, and celery are all high nitrate foods. A large arugula salad delivers a meaningful nitrate load. It is less convenient to time precisely, but the biology is identical. When? With dinner or within about half an hour after. That places the peak in the right window. Consistency. This is not a one-time intervention. The acute effect from a single glass fades. The trials that showed sustained 8-point reductions had people drinking it daily for 4 weeks. Treat it as a nightly habit, not a rescue remedy. Now, who should be careful? There are 4 groups, and this matters. First, if you have a history of kidney stones, particularly calcium oxalate stones, be cautious. Beets are high in oxalates. Daily concentrated beet juice increases your oxalate load meaningfully. Talk to your doctor before making this a nightly routine. Second, if you take nitrate-based heart medication, meaning nitroglycerin or isosorbide, or if you take erectile dysfunction medication such as sildenafil or tadalafil, understand that all of these work through the nitric oxide pathway. Stacking dietary nitrates on top of them can push blood pressure down further than intended. This is a real interaction, not a theoretical one. Speak to your pharmacist. If you are already on blood pressure medication, do not simply add this and assume more is better. Blood pressure that falls too low causes lightheadedness on standing and falls, and in an older adult, a fall is a serious event. Ask your doctor or pharmacist first. Your pharmacist is usually the faster and more accessible option, and this conversation takes 5 minutes. Fourth, if your kidney function is impaired, run this by your nephrologist before starting. And one thing that is not a danger but frightens people every single time. Beeturia. A significant portion of people who drink beet juice pass red or pink urine afterward, and sometimes red-tinged stool. It is the betaline pigment passing through undigested. It is completely harmless. But if you do not know it is coming, seeing red in the toilet bowl at 11 at night is genuinely alarming, and people have gone to emergency rooms over it. Now you know. Let me also be clear about what this will not do. It will not neutralize a dinner loaded with sodium. If you eat a frozen meal containing 1,800 milligrams of salt and then drink beet juice afterward, the beet juice loses that fight. Sodium reduction remains the single most powerful dietary lever on blood pressure, and nothing you drink afterwards substitutes for it. It will not replace weight loss if you are carrying extra weight. It will not replace walking, and it will not manage stage 2 hypertension on its own. And it absolutely does not replace medication that a doctor prescribed. It is an addition. A cheap, well-studied, easy addition that costs you about $1 a day and slots into a time of day you were going to drink something anyway. That is the honest framing. Here is what I would do if I were starting tonight. Before you begin, take your blood pressure sitting down. Same time each morning, 3 mornings in a row, and write the numbers down. That is your baseline. Without it, you will be guessing forever and relying on how you feel, which is not reliable for a condition that produces no symptoms. Then, 1 cup of 100% beet juice with or just after dinner, every night for 4 weeks. 4 weeks, because that is the timeline the research used. Skip the antibacterial mouthwash for those 4 weeks. Brush and floss as normal. Then measure again, same 3-morning protocol. You will have your own answer, in your own numbers, from your own body, and that is worth more than my opinion or any dietitian's. One last thing before I let you go. If you have tried beet juice before, I want to hear about it in the comments. Did your numbers move? How long did you give it? And be honest about the taste. Because there are people watching right now deciding whether to try this. And hearing from someone who actually did it is worth more to them than anything I can say from here. Also tell me this, because I am curious. Do you use mouthwash every night? Because I suspect a lot of people watching are about to reconsider that. And I would like to know how many. If this was useful, share it with the one person you know who needs it. You already know who they are. Everything here comes from published clinical research, but I am not your doctor, I do not know your history, and this is not medical advice. Do not start, stop, or change any medication based on this video. Talk to your doctor or your pharmacist first, especially if you are already being treated for blood pressure. Take care of yourself. I will see you in the next one.